In this lecture, we're going to take a focused view on two individual joints here, in two special cases of the synovial joint. And the first one here is the knee joint. And the knee joint is defined as a synovial joint, but is unique in that it also contains ligaments that are contained inside the joint, and these ligaments are not continuous with the joint capsule. And these two ligaments are what's called the anterior cruciate ligament, and that anterior cruciate ligament, as you can see, has a connection from the femur towards the anterior portion of the tibia, while the posterior cruciate ligament has a connection from the femur towards the posterior region of the tibia. And the name cruciate indicates cross, and so with these two ligaments, because of their attachments, have a crossing-like appearance to them. And these are two important ligaments that provide very important stability to the knee joint during motion. Two other important ligaments include the tibial collateral ligament, often referred to as the medial collateral ligament, and that's what you can see here on the medial side of the knee. And the medial collateral ligament is often, part of it is continuous with the exterior portion of the joint capsule. A unique feature of the knee joint is that, in addition to the hyaline cartilage shaded in blue, is the menisci, or the medial meniscus, and you can see here the lateral meniscus. These are two C-shaped wedges of cartilage, in addition to the hyaline cartilage, that's wedged in between these two bones to provide an extra level of support and shock absorption, because the full body weight is coming through the knee joint. What's not bolded here is not boxed here is the lateral or fibular collateral ligament, which is the lateral portion, the lateral counterpart to the medial collateral ligament. We take a look at the ankle joint. One unique feature of the ankle joint is the talus, which is one of the more proximal tarsal bones of the foot. And the unique feature of the talus that articulates with the distal tibia is that the talus is shaped where the posterior part of the talus is more narrow than the anterior part of the talus. And that has unique implications, because when the foot moves into plantar flexion, the more narrower posterior part rotates and sits inside the joint formed between the entire bone and the distal tibia. Now, what provides important support for the stability of the ankle joint are three major lateral ligaments called the posterior talofibular, calcaneofibular, and anterior talofibular ligaments, identified here by these arrows. And these ligaments located on the lateral side are designed to restrict motion, although motion does happen, but it restricts excessive motion in the frontal plane of the foot with respect to the lower leg. And so what we see here is a key feature of the design of the human ankle and lower leg, is that the lateral malleolus is the distal portion of the fibula, the most prominent lateral extension of the distal fibula, while the medial malleolus is the most medially projected distal portion of the tibia. And what to make note here is that when we look at it in the frontal plane, although this is a posterior view, it's still the frontal plane, the lateral malleolus extends further distally than the medial malleolus. And so what the functional implication of that is that the foot is allowed to move into what's called inversion, which is a medial rotation of the foot in the frontal plane. And the reason that why there is relatively more motion of inversion is because the foot has to move through a larger rotation before the talus hits that medial malleolus, which is a bony restraint to inversion. The opposite of this is eversion, where the foot would rotate in the opposite direction, rotate laterally, but you can see that as it rotates laterally, the talus would hit and contact the lateral malleolus, the distal part of the fibula, much sooner, thereby limiting the amount of ankle eversion that could take place as opposed to ankle inversion. And so this is a major reason, in addition to the talus, the posterior talus when the foot is in the plantar flex position, because it's more narrow, it permits more gapping and more motion inside the joint between the talus and the distal tibia, making the inversion sprain much more likely to occur than an eversion sprain. So this ends our final lecture here on bones and skeleton.